Hi, I'm Dr. Ori Shinar, clinical psychologist. Why is it that boys and men are diagnosed with ADHD so much more frequently? Ask a random person on the street to explain ADHD, and they will more often than not describe the stereotypical hyperactive boy running around the classroom. ADHD, however, is much more complex than that. Many women with ADHD often fall through the cracks. Symptoms of ADHD go unrecognized, or if problems are recognized, they are attributed to other factors or conditions that look like depression or anxiety or even autism. It is possible that through childhood and the teenage years, the female is able to compensate for her attentional weaknesses and other impairments, but the effort she must put into completing her work and managing daily activities in her life is enormous. When she meets with her doctor to sort out what has been causing the overwhelming feelings of depression that have been overtaking her life, to understand why she always feels one or rather 5 steps behind, ADHD may not even be considered. Part of this misunderstanding may be related to her history, which doesn't look like one typically considers ADHD. Also, the normal hormonal changes and fluctuations experienced through her lifespan, puberty, the monthly premenstrual time, pregnancy, perimenopause, and menopause can all affect the presentation of ADHD symptoms. To complicate the picture further, features that are often associated with ADHD, such as depression and anxiety, are often misdiagnosed as primary symptoms. It is these secondary conditions that are more likely to be diagnosed and treated in women, so that the ADHD is overlooked completely. And the women may even feel an initial sense of hope that things will get better with that treatment, yet hope is soon lost when the issues of inattention, planning, organizing, and managing time and emotions continue to harm relationships and day-to-day responsibilities, because the root of the problem, ADHD, has been missed. So she continues on with her life, feeling depressed and depleted, wondering why things that seem so simple for others are so difficult for her, often internalizing negative thoughts about herself, feeling shame, inadequacy, unworthiness, and hopelessness. There is hope. ADHD is a common, highly treatable condition. Life can get better with proper treatment, and proper treatment begins with an accurate diagnosis. My practice focuses on improving my clients' understanding of the different ways ADHD can present in women and how to properly treat the often overlooked and misdiagnosed symptoms.